Today we learn something about diabetes mellitus medications. This is part 5 in the series. Alpha glucosidase inhibitors. Channel's name is Heartbeat. My name is Dr. Amrit Kejriwal. Introduction. It is used for treating type 2 diabetes mellitus. It reduces the rapid absorption of glucose from the intestine. So the main action is in the intestine. It blocks the breakdown of foods such as bread and potatoes. So from this we can understand that it mainly affects the food which is rich in carbohydrates. And it reduces the absorption of some sugars in the intestine. And it has a nice safety profile and prevents any side effects mainly. Coming to the basic information. These are to be taken after the first bite of each meal. It's useful in decreasing raised blood sugar after meals. Usually taken 3 times daily. And HbA1c will be reduced in a few months by 0.5% to 0.8%. So this is quite a big achievement. And it will be used as monotherapy and it requires with diet and exercise. So apart from treatment, you need to do diet and exercise, only then it will be beneficial. There are various molecules available in the market: ACARBOSE, Voglibose, MIGLITOL, and generally they are started with a low dose and gradually increased till the achieved doses are achieved. ACARBOSE is available as tablets of 25, 50 and 100 milligrams thrice a day with meals, that is after the first bite. Elimination half-life is 2 hours, so that if you take it usually within 4 to 6 hours there will be no effect. And degraded in gastrointestinal tract, so it doesn't undergo systemic absorption and can be used in mild renal failure. Avoid in moderate, severe renal failure. Voglibose. It is available as 0.2 and 0.3 milligram tablets. Maximum dose is 0.6 milligram thrice weekly. So this should be thrice daily and slowly and poorly absorbed. Available as combination medicines. Half-life is approximately 4 hours. Lesser side effects than ACARBOSE and may be used in kidney and liver disease, again mild disease, not in severe disease. MIGLITOL. Available as 25 milligrams to 50 milligrams and 100 milligram tablets. Taken 3 times daily after the first bite of meals. Eliminated by the kidneys unchanged. Half-life is 2 hours shorter and that's a short duration of action. Side effects of these medicines. It decreases blood sugars along with usually other hypoglycemic agents. So when usually by themselves they don't cause, but when you're combining them with other medicines they may cause. Other medicines which reduce the blood sugar. Passing gas. Since the carbohydrates remain in the intestine, it causes a lot of flatulence. Diarrhea could lead to malabsorption, which leads to diarrhea. Upset stomach. Abdominal cramps. So these are the common side effects with alpha glucosidase inhibitors, that is ACARBOSE, Voglibose and MIGLITOL. Contraindications. So if a patient has a major intestinal disease such as ulcerative colitis or Crohn's disease, avoid it. Obstruction in intestines. Patient is in diabetic ketoacidosis, which is a complication of type 1 diabetes. We have not been discussing type 1 diabetes. And if the patient has intestinal problems. Missing a dose. So occasionally many patients miss a dose. So if the next meal is near, take regular dose with the meal. It is to be taken 3 times a day, so it's very easy to miss a dose. And if next meal is delayed, then it can be taken with a snack. Thank you for watching the video. Please do not forget to like the video. Feel free to give comments. Please subscribe to the channel and share link with your friends. Thank you once again.